A large majority of Americans surveyed in a new poll believe the U.S. healthcare system is in a state of crisis. Now, this is according to a new Gallup poll, which showed that 70% of respondents believe the healthcare system has some significant issues, compared to about 30% who says, oh no, it's absolutely fine. Really? Now, I love the breakdown here that I'm going to show you. So this breakdown, of course, it looks at partisans, right? Now, those obviously who identify as Democrats have more consistently rated the healthcare system as a major problem. Now, of course, that also happened during the Obama administration, but I think it was actually less. So, yes, during the Obama administration, you still had a lot of Democrats that are like, no, even with the ACA, the healthcare system is problematic. Now, that's not surprising considering over 70% of Democrats, I'm sorry, not 70%, 85% of Democrats believe that single payer is a system that we need to go to. So, but nonetheless, during the Obama administration, there still was a higher percentage of people, of Democrats, that were like, no, the healthcare system is okay, it's got some problems, but generally it's okay. Now, Republicans, a little bit different. Now, Republicans, 56% say the healthcare system has major problems. So you still have a majority of Republicans. That's about the same percentage of Republicans that say we should go to a single-payer system. That's also very interesting. But that's actually down from 70% a year ago and from 80% in 2016. Now, you guys notice the difference here, right? The difference here is who is president. Shockingly, or not shockingly, Republicans, now that Republicans, or there's a Republican president, and for the last 2 years has been Republican rule, we're like, oh no, yeah, the healthcare system is actually getting fine now. Whereas when Obama was president, more Democrats were saying, oh no, the healthcare system is fine. Even though there is a solid majority on both sides that throughout the whole time, no matter who is president, is saying this healthcare system is broken. It is absolutely broken. And again, I'm in that group, right? Because I've known that the healthcare system has been in crisis for a lot longer than 3 years. We've needed single payer for a very long time, decades. Now, again, unfortunately, you have people who are in office, or I'm sorry, people changing their opinion depending on who's in office. So, you know, and it's weird because we've almost had no changes in policy over the past couple of years. Yes, you have had attempts to repeal the ACA that have absolutely failed. But as far as major policy changes go in the ACA, they haven't really made a whole ton of changes. Yes, you've made a few. For example, the individual mandate and the return of junk insurance plans. So you've had some deregulation, right? Now, the thing about that, right, is that those junk insurance plans, they're not exactly what people were asking for. But that is a situation where Republicans sold it to their base to say, look, we lowered insurance costs. Now you have cheaper plans. But it turns out when you use those junk insurance plans, yes, you don't pay as much now in premium, of course. But if you're going to actually need to use that insurance someday, well then you are definitely going to pay. There have been a lot of stories. And look, you know, I've talked to my... So here's the thing. Every time I go to the doctor, right, I always ask, or if I see a different doctor in a different place, I ask, what do you believe that we should have a single-payer healthcare insurance, a single-payer healthcare plan? Now, everyone that I've asked, and I haven't asked a lot, but and this is all anecdotal, by the way. I've asked them, you know, do you believe in single-payer? And they said yes. Now, one of the doctors that I was talking to talked about these junk insurance plans. That they say, oh no, I've got a $25 deductible. How come I'm getting charged $1,200 for one visit? And they say, well, that is your deductible. You actually have to pay that first. And they don't understand how that works. Most people don't understand that in order to see the doctor, you have to pay this gigantic deductible. These are the people that went for those junk insurance plans. And so that's why we call it junk. because you have such a high deductible and the coverage on it is barely coverage at all. It's flimsy. So, but of course they end up getting mad at the healthcare system, or not the healthcare system, but the doctors in general, when it's the healthcare system that is the problem. But anyway, overall, I think people from both sides generally, based on the polling results, think that this is terrible. And it's because it is. The ACA is, yes, it was a step, but it was also terrible. It's basically, as Ron Placone always puts it, putting a Band-Aid on a broken arm. The problem is for-profit healthcare. This is where you don't need a market-based solution. Now, look, there are places where free market solutions work fantastic. If you're, trying to buy a car, then that's where you have a good market-based solution, right? That's where you have competition to see who makes a better vehicle at a cheaper price. Same thing with shoes, same thing with electronics. But you know what? Healthcare isn't the same thing as that. Healthcare isn't the same as an iPhone. Choosing a healthcare plan is not the same as choosing between Apple and Samsung, or Apple and Android. It's not the same thing. It's where you actually should have guaranteed coverage through the government. And that's actually part of what government's actually supposed to be there for, is to do things that the private market can't. Or at least can't at a competitive price. But anyway, our market-based solutions is kind of what got us to that position, right? Insurance companies regularly raise premiums, deny care, fight with doctors about what they will and will not cover, and then in the process, pocket millions of dollars for their CEOs and spend a ton of money on advertising and administration. It is deeply inefficient. For-profit healthcare is the problem, not who the president is. And again, the president does have the ability to at least push legislation and say, this is what Congress should be doing. You should put this piece of legislation to the floor and use that bully pulpit. But again, President Trump never really cared about healthcare. I remember when he promised, oh no, we would have fantastic healthcare. It would be tremendous. We would make sure that nobody gets left out and nobody dies in the street. Everyone will have healthcare. Well, how did that turn out? About the same as when Democrats promised that the ACA would give everyone healthcare. It didn't. It didn't. And all these promises of, oh no, we want to give affordable access to healthcare coming from some Democrats is terrible. It's a terrible policy. And of course, it's not going to work. The only thing that'll work is a single-payer healthcare system, Medicare For All, HR 676. The system is broken, and we need that single payer. And again, most people want single payer. Over 70% of Americans agree we need a government-sponsored insurance plan paid for by taxes with the power to negotiate with drug companies and hospitals for lower rates. We will actually save money. Studies have shown that. Even the Koch brothers funded study from the Mercatus Institute that tried to argue against single payer ended up finding that at most it would save $2 trillion a year in healthcare costs. That in the long run, it would actually end up being cheaper. And I'm sorry, that's $2 trillion over 10 years. So when everybody brings up that number, $32 trillion, oh, it's $32 trillion, $32 trillion. We already pay that right now. And the projections within 10 years is that we'll be paying $54 trillion in healthcare costs. Whereas Medicare For All, but still over 10 years, costs about $32 trillion. You want to talk about cost? There's the cost. And that is the most conservative estimate. We can do this. It will be cheaper. And it actually will give people a higher standard of healthcare. So it's a solution that almost everyone can get behind. Unless, of course, you're a health insurance CEO or a politician or a lobbyist. We are in a healthcare crisis. Everybody knows it, and also everybody knows how to solve it. Medicare for All. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent, progressive media.